Thank you, Julie. 7:32, everybody. Monkeypox, COVID, and this sloth fever we're talking about are the viruses to look out for as kids head back to school today.
Yeah, New York City Health Commissioner Dr. Ashwin Vasan is here to guide us on how to have a healthy start to the school year. Keep it staying healthy, right? Good morning, Dr. Vasan. Thank you so much for being here.
Good morning. Glad to be back.
So let's start with this mosquito-borne illness situation. Mosquitoes are everywhere, I feel like, especially at the playgrounds in Harlem and the Bronx.
Yeah.
What are we doing to combat that?
Well, a lot. We have probably the most sophisticated mosquito control, vector-borne disease control program in the country. And that's a hard-won lesson from our West Nile virus history, which started in around 1999 here in the city. So we test mosquito pools in thousands of locations around the city. And based on when we find positive samples in mosquitoes, we spray. We either do aerial spraying or we do ground level spraying of adult mosquitoes and for eggs. And that has proven to be really effective at controlling mosquito pools. And obviously we do a lot of communication with the community about when we're going to do that in advance. And you know, the advice to New Yorkers, though, we know that vector-borne diseases are on the rise across the country, and that is a part of climate change. We have warmer temperatures, longer rainy seasons, so wearing a EPA-approved mosquito repellent, especially in the mornings and in the evenings, long sleeves. With this temperature, it's perfect because long sleeves are perfect. Making sure you have screens on your windows, removing standing water from your property, and calling 311 if you see standing water, because that's a health code violation.
Why did it seem like there was such an increase this year, right? With West Nile, there's dengue fever, there's monkeypox, there's sloth fever, and it seems like it's kind of all happening at the same time as kiddos head back to school. So is there one that's more alarming than the other, and why do you think it's more prevalent?
Well, just to be clear, New York is not facing all of those conditions. I think there is a lot of press from cases.
You hear the terms, yeah.
You hear the terms, so I totally understand that awareness. We get about 17 cases on average a year of West Nile virus. Right now we've had 10. It's a little ahead of where we were, but not dramatically so. September is always the peak month of that, and so we'll see where we end up. But yes, I mean, like, this is the new normal of mosquito-borne diseases because of these warmer temperatures and longer rainy seasons. So it's all about taking smart precautions.
Okay.
All right, let's talk back to school. Immunizations for kids, right? They're mandatory. You check them. What happens if students don't get the shots necessary?
Well, I'm a parent first. I have 3 kids going back to school. I'm so excited. And like every other New York parent, we're so excited to get our kids back in school. There are 9 vaccine preventable diseases that are required to have, you're required to have an up-to-date immunization K through 12. And in the event that you're not up to date, we give a grace period to students and their families to get a young person vaccinated and up to speed.
How long is the grace period?
It depends on your situation. So if you're a child, for instance, in shelter, if you're a child who's facing housing transitions or other social or economic challenges, we work with the family to make sure that we get that kid vaccinated without excluding him from school. But there is an end date, and every student has an end date. Every family, every parent is communicated with, and after that end date, that's when you're subject to potential exclusion from school. And that's a blanket policy. There are no exceptions, no exemptions, no religious exemptions, no exemptions for migration status. This is every student in New York City public schools as well as our private schools has to be up to date.
I was wondering about migrants because usually you have to show forms, right, from your doctor, but a lot of those families can't get their forms. So how are they in school if we don't know what shots they've had before?
Well, there are ways to check, right? So you can check a young person's immunity based on antibodies. So we can get blood tests.
Are we doing that in school?
Not in school. No one's doing that in school, but we can do a pediatrician visit, an annual visit. So that's why we start campaigning here in August and into September. We want parents to get their kids back to school with those annual physicals. And sometimes that's blood tests. Sometimes that's just an updated
But who's paying for it?
Booster.
Who's paying for the migrant children to get that kind of testing?
Well, we've got a whole network of safety net clinics throughout this city, federally qualified health centers, health and hospitals. We have our public health clinics where care is free of charge. Care, regardless of your ability to pay, we take care of you. We'll never say no. So, and that includes routine screening for kids.
So for every migrant child that's in school, we are checking to see if they are up to date with their immunizations.
where every migrant child in school has to be up to date. Every child in school has to be up to date on their vaccines in order to stay in school.
I want to get to COVID protocols in a second, but let me just ask one question. So there's a start date for that student who's not immunized, right? How long is it until the end date?
Well, it really depends on the situation of the child, right? So if you don't have those social challenges, if you have stable housing, if you have a stable family situation, then your grace period is going to be shorter than someone who's got some of those social transitional challenges.
I want to get to COVID protocols real quick because it is still here, right? And it is the new norm. Do teachers still have to report to school if they become infected? What's the time period that they are not in the classroom versus not in the classroom, and does the same apply to students?
Well, the basic guidance is there's no more minimum period of isolation, but rather stay home if you're sick. If you're sick, do not come into school, whether you're a teacher, a student, a parent, spending time at the school, anybody in our school environment or even in a workplace. Don't come in if you're sick. You need to be symptom-free for at least 24 hours before you come back. And then for 5 days thereafter, there are smart steps you need to be taking. Wearing a well-fitting mask definitely will help reduce transmission. Staying away from people with vulnerable medical conditions or elderly people, older adults. And obviously hand washing and hygiene and a little bit of distancing makes a lot of sense, but you can get back to your job or school with those precautions.
As long as you're 24 hours without symptoms.
As long as you're 24 hours without symptoms. And we know that COVID can undulate, right? So you can be symptom-free and then develop them later, but as soon as you develop symptoms, you should be home. You should not be in school, whether you're a student or a teacher, with symptoms.
Are you worried about an uptick?
Well, I mean, I think we're seeing the virus do what the virus does, which is try to evolve, try to evade our immunity. We have a very well-matched vaccine this year.
Yeah.
Very well matched, actually, probably one of the best matched that we've had in the years of COVID. And so I recommend that every New Yorker, but particularly people over 65, particularly people with underlying medical conditions or around people with those things, go get vaccinated as soon as possible. We do have select pharmacies that are already stocking the new COVID vaccine, but by the end of this week into next week, we should have it widely available throughout the city.
All right, Commissioner, appreciate you being here on the first day of school, talking about so many things, so many topics. Great to have you.
Great to be here.